Hello, all. This is Dr. Dheeraj Masapu, and this is a continuation to my previous super hit video called Highest Paid in 2034. So, in that video, what I spoke about is how you should select your specialty based on what is going to trend in future than what is trending now. Okay, so there in that video, I also explained about how your career graph and market graph will intersect, and some people actually, grow by that intersection point. For some people, they never intersect. The market graph would be going like this, and the career graph would be going like that. I mean, some technologies favor by default certain specialities to grow. So, if your career is touching that market intersection point, you're going to grow. So, these are the aspects I covered, and I also spoke about the demographics of the Indian population, how they're going to change in the next 10, 20, 30 years. And based on that, how you should select your specialties is what I told in that video. Link is there in the description. You can check out that video. That's almost like 2 lakh views are there for that. So this is the second part to that. The second part to that, and here what I'm going to cover is in this video. I'm going to tell you the new economics of medicine in India and globally also. Okay, and then second, I'm also going to tell you two major financial pillars to define the healthcare system of India and who will be the best paid doctor in future. So these are the elements I would cover in this particular video. So in the process, I would be telling you a lot of things like how insurance is going to affect and why certain specialties are going to actually this one how capping is going to affect and all that. It's a little lengthy video, but it is researched by talking to so many doctors, heads, billing departments, and then admin people, and then we have made this particular video script. Okay, please focus and listen to particular this video, and it will change the way you actually think about medicine. If you are MBBS person watching this particular video, then you are very lucky because this video can be a guiding video for you to how to plan. So let me enter into the proper script. So focus. The most important, see, what I'm going to tell in this particular video is not only for surgeons. Okay. I might talk in terms of surgeries and different areas. It means that the team, particularly. Okay. Like, for example, if I'm mentioning oncosurgery, that means I'm also talking about onco anesthesiologists, I'm also talking about radiation oncologists, I'm also talking about nuclear medicine and allied specialities to that particular zone basically. Okay, for the simplicity of the script, I'll be talking about the particular areas like oncosurgery, if I tell, it implies that. So that is the disclaimer before entering the video. Okay, so basically I recommend you to position yourself in these particular zones. It's for the team basically, not for one individual surgeon. Okay, even though surgeons earn more than other people, but everyone would make a lot of money in those particular zones. So first concept that you need to understand in the particular healthcare industry is the future is the currency of healthcare would be complexity. I'll try to tell you. Okay. For example, there are two types of procedures. One is very simple, like a person who's finished his MS or MD, like is able to do immediately. Then it is not a very complex procedure. You need no special training in that. Or there is another set of procedures who like performing that is very complex, and it takes a decade of experience to actually master that. So then it must be very complex zone. Not only you and me, even insurance people know that, even general public know that. So usually what happens is those are the type of surgeries, they have a separate currency. Okay. I mean, they actually, claim more packages in insurance, or if you are paying through cash, you have to pay more money to get those surgeries done. Okay. I'll tell you what are those areas. So you can see the list on the screen. Neurosurgery and spine surgery, liver, hepatobiliary, and transplant areas. So basically, these two zones, what happens is the number of experts also are less. You might be telling there are so many hundreds of neurosurgeons, but I'm talking about experts. Even if you're there in that zone, to become an expert, it will take a decade's time. Your training matters. The institute where you got trained matters. After that, where you're working matters. Everything matters. For example, if you're a neurosurgeon and then you are working in trained in a best center and then you worked in a best center for some years, then you are considered an expert. There are some people who train in one place, then they go to tier 2, tier 3 places, they do business. So you don't qualify. You you qualify as a neurosurgeon, but this expert variety you don't belong to, is what my personal feeling is. So because the video will go more and more into the complexity kind of zones. And then the financials also I would tell later on. Okay. So liver and hepatobiliary and transplant is another area where very few experts are there. And not only that, these two zones, along with CTVS, would require a very, very good ICU backup. So anesthetics, ICU backup, everything is required. A lot of investment is also required by the hospital to do. It can't be done in some chutki pitki hospital. Okay. So this is about that. Oncosurgery also will come in this category. Along with that, oncosurgery requires a full length setup like PET scan. It requires radiation units. So many people are required here. So these are the things. So orthopedics, if I have to tell you, then orthopedics, two genres are there. So one genre is people are doing only ACL, scopies and all that. That is not a very, very complex work. And the insurance packages and all would be lesser in that particular area. And the other side, who does only knee replacements and complex hip reconstructions and all would fall into the complexity category. And there, the bills and all would be more, the packages would be more in insurance. Okay. So these are the main areas I would suggest. And the second, the most important aspect I feel is driving the healthcare economy is the insurance driven revolution, which is going to happen in India, which happened already in other countries. It is happening now. Okay. By 2035, that is 10 years down the line, 60 crore Indians will have insurance. At present, I think around 3 to 5 crore people are having, 60 crore people will have insurance. I'm not talking about the Ayushman Bharat or, no, or Aragyasri in Andhra or not that. Proper insurances like HDFC, Ergo, Niva, Bupa, like Star Health and all that would be there. And then like 5 to 10 lakh coverage would be there for 60 crore people. So the specialties which are aligned with these insurances will benefit them most. People wouldn't take money out of pocket and pay. They are paying now. There are a lot of cash-based payments, but in future, those kind of payments will decrease. More of insurance-based payments would happen. So you need to have a very, very clear understanding about how the insurance-based billings, insurance-based payments happen. You type anywhere in GPT, Google, and anywhere, nowhere you will get this information which I'm going to tell. Okay. So when I did my research, what I understood is, and uh, there are certain specialities which are considered by insurances as complex, and they keep something called as open billing concept. That means that there are surgeries which are life saving and multi specialty or multi team involvements and high level equipments are required. Okay, the equipment investment itself will be in crores. Longer hospital stay due to their morbid procedures. They'll need a lot of time stay in the ICU. Lot of consumables are required like stents, grafts, valves, screws, implants. So they need to be imported from our country. We don't manufacture, right? No, India, we don't manufacture anything. Everything we import only. I think that also might change in future. And so these surgeries, even insurance people know that it is not possible to do in that particular small package they're giving. So they do something called as open billing. I'll go into more details of that. Okay. And then you'll understand better. So for example, let me tell you first a closed billing and then I'll go to open billing. The closed billing is, for example, there is a GA surgeon, okay, MS general surgery guy who does only small hernia surgery, and he got the insurance approval. And then we'll leave the cash payment. Only insurance is the future, right? We'll focus more on insurance here. And he has done a hernia surgery, and then uh, at the end of it, the insurance. Now, insurance is decided by something called GIPSA. So, GIPSA is nothing but all the insurances, private, public, government, everything. They have come to a common platform called GIPSA, and all the rates are fixed there. For example, a hernia surgery, anywhere between 50 to 80,000 would be fixed there. Even if you have a 10 lakh insurance, the GIPSA would only give you 80,000 for that particular surgery. So, hospital should operate in that particular rate. Okay. So if by chance you're an MBBS doctor and you position yourself as a GA surgeon and you're doing a good amount of hernia surgeries, like you're doing 20 to 30 hernia surgeries in a month, very good job you're doing. But unfortunately, you will only generate only how much 80,000 or 1 lakh per case, 20 to 30 lakhs in a month is what you generate. Because the GIPSA has decided, even if patient wants to pay more, he cannot pay. GIPSA wouldn't allow because his insurance would only give you 80,000 to 1 lakh rupees. Okay. But if you position yourself as the specialties which I mentioned before, the complexity area, let us assume you are oncosurgeon and then you posted some patient for radical resection or hemicolectomy with something and all that, post-op radiation and all that. Insurance will consider that this is a complex zone. It can't be done in the GIPSA package of 2 lakhs or 1.5 lakhs or something. So it will allow you to make something called open billing. So then hospital and the insurance will have a certain kind of an agreement called MOU, and then they will decide that these particular surgeries, patient pays a part, insurance pays a part, and then hospital decreases a little bit. So overall, we'll do this particular surgery in 7 to 10 lakhs or 7 to 8 lakhs or whatever X amount they will decide. It will be significantly more than a hernia surgery. So at the end of it, hospital, even if the oncosurgeon does the 10 cases, he would generate 80 lakhs to 1 crore revenue, which is significantly more than the GA surgeon. So both are excellent surgeons, but by default, because of the system, one person actually shows more revenue, another surgeon shows less revenue because of the insurance system. And insurance people are also not fools actually. They're doing that because they don't want to trouble the patients. They know that if they fix 2 lakhs for that particular surgery, hospital cannot do it. So insurance people are actually good. They are considering from patient side. They are considering they know that if we fix that, patients cannot get quality treatment from that hospital. That is why insurance people actually they're taking a step back. They're agreeing for open billing. They are paying more money from their side to help the patients. At the same time, the doctor also is getting benefited because he wants to give best care to the patient. Without money, what care he will give? So doctor is also getting benefited. Patient also is happy because insurance is paying 80%. Patient only pays for the consumables, which will come around 80,000 to 1 lakh for one major procedure. So everyone is benefited in this open billing concept. So these open billing concepts are there for the specialities, which I'll tell in more detail in the next coming slides. Okay, here some are here. So neurosurgery is spine surgery, cardiology, CTVS, oncology, and transplant. In GA surgery, if you're going towards colorectal side, in orthopedics, if you're going towards joint replacements and hip replacements and all that. In urology, if you're going towards kidney transplants and all that. So these are the areas where kidney and liver transplants, thoracic surgeries like lung surgeries, and all these things also we can put in this particular category. Okay, so these are the areas where you actually can go into this open billing. You can actually get more revenue for the hospital. So if you position in these areas, you'll be making more money for the hospital, and then they will have some money to pay you. Okay, so these are the things. So if I'm telling, already told a disclaimer in the beginning, if I'm telling neurosurgery, that is not only neurosurgery, it is also the neuroanesthesia, the neurology, the neuro this thing, and technicians are working there. Everyone will get benefited. Got it, no? So that is the concept till here. Let us go to next concept. So here you can see typical. This is a rough estimate only of in this slide you can see what specialty, what is the average insurance package, roughly what is the range, what is the doctor's typical share. The doctor's share is like including all the doctors involved. Okay, for example, I thought like high power surgical, like neurospine surgery, onco liver transplant, anywhere between 3 to 10 lakhs can be cost of one surgery. Doctor share would be anywhere between 15 to 20%. Like all the doctors were involved in that, not one person. Okay, cardiac and thoracic would be 2.5 to 5 lakhs. So intervention and like ortho 1.5 to 3 lakhs, and then oncology can range. I already told 3 to 10 lakhs. So these are the different average insurance packages that would be there in the open billing system. In the GIPSA, if you see, you won't get to see these kind of numbers. You'll see only like 1, 2 lakhs. That's it. But when you make it open billing, you can actually request or with the MOU that more money should be is needed for this particular procedure. Okay. If you are a patient watching this video, why this doctor is talking about why they should charge more money for this particular thing? If you're thinking like that, then my explanation is if we have to, number one is we're doing in 1/20th of the cost of USA, that's a different story. Second important thing is the equipment that we invest to treat you are worth in crores. Like 10 to 15 crores is the cost of neurosurgical equipment, basic things. Like hospital like ours, we have invested 30 to 50 crores for neurosurgical equipments. So we have to pay interest on that. And also for one brain surgery, there are 40 doctors working, 50 nurses working. So many people's salaries would be there. So it is not that hospitals are minting money. Okay. To give that particular care to you, We so many people are actually working. Our dream is to give that kind of care to you. It is only possible when money is there. That's what we're doing. Okay, let's go to the video again for doctors. These videos are for doctors. If you're a common man watching, please, okay, don't misunderstand me. Let's go into the concept of video again. So next concept which you have to understand when you're planning your career is the capping. What exactly is capping, if you ask me? So what happened a few years back is government realized that in certain areas some malpractice is happening, like stents in cardiac, knee replacements, and all that. Government felt that, public felt that unnecessarily doctors are doing. And then what government did is they decided bare metal stunt. Stunt is the device which you know, to a common man. Then stunts are fake cap. The capping was done around 10,600 for bare metal. Nobody does bare metal. Everyone uses drug-eluting stunts. That is 38,000. So previously it was 1.5 lakh and 2 lakhs and all that. Around 1 to 2 lakhs is the cost, but now only 38,000. There is a maximum cost they can put for the stunt. Knee replacement was like the implant cost was very high. Now the implant cost is 50,000 only. You can only charge that much. So now how does this affect your particular salary? Also you should understand. And in future what is going to happen is the capping is not going to stop here. It will come to onco side on the cancer drugs. It will go to gastrointestinal side on procedures like liver resection, GI surgeries and all that. It will go to nephro side. It will go to neurosurgery side and spine surgery, the screws and everything. I think the capping will affect all these things, but you don't have to worry. I will tell you why. So capping will affect multiple areas in future. No doubt in that. So why you should know about the capping? So what is happening now is even the capping is there. Okay, some kind of internal adjustments would be done. And for patient, capping is actually better because the amount of money he's spending on the particular stent is decreasing. So when I inquired with all the doctors who are working in the capped zones, what they told me is one thing. Dheeraj, when capping is there, it is actually good, they told. I asked like why? Because when previously when we actually had to put two stents for one patient, the actual patient required the second stent also because of the critical stenosis. We used to think a lot because the cost of stent is 1.5 lakh. Now since the cost of stent is less, we are free to actually put one more patient is also fine. So they felt that they can give the best care to the patient. See, every cardiologist or every knee replacement surgeon, what they finally want is not money. What they want is their patient should go home safely. They don't want any headache in the night. And this particular patient should get more people for them in future. This is how they think. Okay, nobody is going to think how much they're extracting from that particular patient. Those days are gone. Okay, if you're thinking like that. So the people with whom I interacted are usually the best of the best guys. They told me that for the patient, they're free to use the best quality balloons now. It is not only stunt, but they directly don't go and put a stunt. There are a lot of balloons involved in cardiac. They can use the best balloons. The reason is the stunt is capped, right? So they can invest that money in getting the best balloon. So previously, since the stunt is more, they were using a low quality balloon. Now they can use the best balloons. They can put more number of stunts to the patient if required. So because of that, the patient outcome is better, is what they thought. Okay. So now, for example, stunt. I'll tell you pre-capping and post-capping how the example scenario I would like to tell. Pre-capping, like pre-2017, hospitals would make use tents which are like around 1 lakh, 2 lakhs, and all that. And then hospital would have some kind of a margin on that. Okay, so like a 40% margin would be there on that particular device. Now that is not there. The margin is shrunk because the cost is fixed to 38,000. Only like 10% or 5% margin would be there. Okay, hospital actually is in loss. So then what happens if hospital is in more profit, the consultant fees would be more. Now, since the hospital is margin is not there in that particular area, the amount of money they pay to the surgeon also will decrease. So that is the problem of capping. But still they play a number game. They will do more number of cases and then they will try to compensate. That is what they do. Okay. See, most of the doctors with whom I interacted are in top position. They're not bothered about how much money they get per case. They want a peaceful night's sleep with best care to the patient. That is what they're bothered about. Okay, this chiller 5,000, 10,000, and all, they're not bothered. Okay, so this is, but in a person is doing only one case in a week or something, for him actually it might affect. But surely after capping, the amount of money a doctor would get would come down. work, but they are able to give best care. I hope you're understanding what I'm trying to tell. So capping indirectly will affect the income of the doctors. Okay, so that is about the cardiology story, which I already told you. So revenues after capping. Okay, the centers, because the capping has decreased the size of cost of the stunt and all that. Now the revenues actually, according to the cardiologists, the revenues actually have increased. It seems. Why? Because now since the capping is there, they are able to use more stunts. They're going to give, they're giving best results. They're saving more people, and then more numbers they're doing, and revenues are actually not affected. So they are not bothered. So that is about the capping. So, but number to number, if you see, capping will decrease your salaries, but still, if you go inside and discuss with the people, overall it's not going to affect. You have to do more number. That's it. So, with all this knowledge of this thing, if you're an MBBS person, then if you ask me, Dr. Viraj, you told all these things which are going to happen in future, where should we position ourselves? So, my recommendation is position yourselves in complex zones because they favor open building concepts in future. And then, like those areas are neurosurgery, spine surgery, oncosurgery, transplant surgery, aptability surgery, and complex orthopedics, complex ENT, and all those things would come. And low closed package concept is there in OBG, cardiac stents, orthopedic basic procedures, general surgery, hernia, hydrocele repair, and urology basic procedures of stone removal, and all that would come in closed package where you like 70,000, 80,000 is the package that insurance will approve. Open billing cannot be applied. So you need to do more number of cases there to get the same revenue that a complex person is doing. So if you're passionate about doing that, you can do, but I recommend going into complex zones. Okay. So that is the thing I would recommend. And then there are certain areas which insurance will not apply. They're like self-pay cash patients. IVF is one area, cosmetic is one area, bariatric is one area, pain medicine, sleep medicine, and all those areas are not covered by insurance. So if you want to enter those zones, this video is not relevant to you. They're 100% brand driven, and then you need to have personal brand there. You need to attract more this thing, and those are more not. Those are the areas which you should enter when you have that kind of personality only. So hope I think this video helped you in uh, what to say some understanding about how healthcare works now and in future. And based on this, you can maybe decide where to position yourself. Or if you decide that side, any side is fine. And so this is what drives the healthcare economy in future. And I feel so this is how it is going to be in future. And I think, see, one good news is that my mentoring will continue, but the I'm not able to deal many people. Because a lot of people are actually registering, so I'm not able to deal with my busy schedule because I'm not a full-time YouTuber. I'm a full-time neuroanesthesiologist, and I'm doing these videos to educate you guys because this is my passion to do. So this mentoring also, why I'm doing is, like if I interact with you one-on-one, I get to know your real problem so that I can design my videos in a better way. That is why I do that. So either I have to stop it or make it very expensive so that only few people I can mentor in future. That is what I have to do. So this month I will decide and then I will let you know. Okay. The link is there in the description. Link for the actual highest paid is also there in the description. You watch both. First you watch that video and then watch this video, then it makes more sense to you. Okay, thank you guys. Thank you for following the video till now. Thank you very much. As usual, Dr. Dheeraj Masu logging off. Roger that.